Hello and welcome back to Late Night Study with you, episode number 2. After the last episode, I find this method is really good, so yeah, let's continue. So today lesson we're gonna talking about oral hygiene. Oh, by the way, I'm in Portuguese right now. Yeah. So we're gonna talk about oral hygiene, which is one of the question we have in the exam. Let's get started. Okay, so we all know that oral hygiene is important, but uh, especially for older adult, it's more important because let's see why it's important for older adult. But okay, prevention of when we have a good oral hygiene, we can prevent oral disease such as tooth decay and gum diseases. And we can also prevent infection and inflammation of the bacteria that might happen in our mouth. The second thing is to connect. It can connect with systematic health, for example, heart disease and stroke, because um, they say that the bacteria that go from the tooth decay or the gums that might like that have been infected, so that can go to your like from go in the bloodstream and can infect the heart and other things too. Diabetes, when we cannot like we eat too much sugar, so we also have the tooth decay and also the diabetes. So yeah, and respiratory infections. So such as like when we have the when we have tooth decay, so we usually have the smell is not good and the smell from our mouth, and also when we respirate is also affect somehow. I guess I don't know. Uh, Healthy teeth have allow us to proper chewing and digest food, and toothpaste a lot can limit the food choice, leading to nutritional efficiency. And also, we also can feel very hard to eat the food when we have a bad teeth, right? So, yeah, that's the reason why we should keep our teeth clean and healthy. And self-esteem and social well-being, as far as I mentioned before, when we have bad teeth, so the smell is bad, and also we cannot have a good smile. So, yeah, some of the challenge when to maintaining the oral hygiene. The first is dry mouth from older people. They often because of the medication, and it reduces the saliva and creates risks of decay. The saliva is important to keep our mouth moisture and protect our teeth, protect all of the good bacteria in here. And if we don't have the saliva, so yeah, it can make dry mouth. We feel hard to eat, hard to pronounce, and to talk. And food tooth loss are dangerous. It may cause discomfort or difficulty in eating. Is really easy. Limited dexterity or mobility, and conditions like arthritis make brushing and flossing harder. Uh, Also, some older people they don't have enough money, or they have too far, or they scared of going to hospital, go to the dentist. Can can prevent the regular checkup. And regular checkup is important so that we can know exactly. We can know like earlier. We discover earlier the what I say. What we call earlier the risks of the tooth decay or tooth loss and something like that. Chronic health condition like Diabetes, heart disease, and cancer treatment can affect the oral health. Uh, some of the disease like cancer may also affect how we eat and the food we eat and how we clean, how we keep the health, keep the mouth clean. So and also poor fitting dentures can cause sore infections if not cleaned or adjusted properly. And here is some of the strategy to overcome those challenges I mentioned before. Daily care, which is brush at least twice a day with soft toothbrush, and use floss holders and interdental brushes, water flossers. It's really common to see these days in the store or in hospital. They also sell that one. And use mouthwash to reduce bacteria and freshen breath. Managing dry mouth. So we have to let them sip more water often. Chew sugar-free gum so that it reduces the saliva and also use saliva substitutes. Avoid caffeine, alcohol, smoking, which is worsen the dryness. Denture care included like clean dentures daily and remove them at night. And we should put them in a liquid that will keep the dentures clean and no infection. And so visit the dentist regularly for fit adjustment or to avoid irritation. You also let older people eat soft and nutritious food that include the calcium, vitamin D, and protein, which is good for good for teeth. Also, we should limit the sugar, snack, and drinks, and obviously avoid tobacco and excess alcohol. And you should let them visit every 2 or 6 or 12 months with the full dentures with the dentals. Okay, bye bye.